Good afternoon, everyone. My clock says noon, so we are going to get started. I'm sure we'll have people joining us over the next few minutes, but we want to be respectful of everyone's time and keep this town hall to the scheduled 45 minutes. Please know that this is being recorded today. It is great to see so many friends on the call. My name is Whitney Harmel, and I'm the Vice President of Membership and Development at the Maryland Chamber of Commerce and the Maryland Chamber Foundation. Like many of you, I am a proud volunteer with the United Way of Central Maryland. We are grateful to have each and every one of you joining us today, and we're kicking off this conversation with a quick poll, which you should see coming onto your screen in just a second. This is a very special event that is hosted by the United Way membership groups. Membership groups are networks of donors connected by their action to become more informed about the issues facing our communities today in an effort to create positive change. We are also joined today by our community impact leaders, our board of directors, the Region United Network boards, and of course, our corporate, nonprofit, and foundation partners. I'll give you a few more seconds to add your answer, and let's see who is joining the call today. Okay, so it looks like we have a really diverse group of members and volunteers in the town hall. Thank you to everyone who is spending this time with us. So I was first introduced to the United Way of Central Maryland in January of 2014. I was going through an extremely difficult period of time in my life, and when I attended the annual Wine in the Winter event hosted by the Emerging Leaders United, I walked into a room of people who care about the community, and I have to say I instantly found what I had been missing. Over the past 6 years, I've had the honor of serving as the Emerging Leaders Chairman and Vice Chairman. I've been on various committees, and I currently sit on both the Board of Directors and Executive Committee. Like so many of you, I have partnered with the United Way as a vehicle to serve my community. And that is exactly what this conversation is about today, how we as a collected and unified group can support our neighbors. All right, so enough about me. I have a few housekeeping items to run through before we hear from our speakers. So this is a 45-minute interactive discussion, and I want to emphasize interactive. We want to hear from you. We will be monitoring the chat feature and answering questions as we go through this conversation. So please go ahead and put in some questions as you are hearing from our speakers. I, of course, will do my best to keep everyone moving forward so that we can get to your questions at the end. Please note that there's also what they call a speaker view. This will help you to minimize how many people you see on your screen. So our goal today is to give you a behind the scenes glimpse of what's happening at the United Way so that you are well informed. We will also share what you can do now and in the coming weeks and months as this continues to unfold. All right, so I'd like to introduce our speakers. Of course, we have Franklin Baker, President and CEO of the United Way of Central Maryland. We're also joined by Triff Alatsis, editor and publisher of Baltimore Sun Media and our 2019 United Way campaign co-chair. Also from the United Way of Central Maryland, we have Sandy Monk, Senior Vice President and Chief Impact Officer, Holly Hoey, Senior Vice President and Chief Principal Gifts Officer, and Ann Johnson, 211 Maryland Information Specialist. All right, let's get to the heart of this conversation. Franklin, I'm going to start with you. We have all been thrust into a world that is changing by the minute, and business is changing for everyone. Can you tell us, as President and CEO, what is it about the COVID-19 pandemic that is keeping you awake at night?
Thank you so much, Whitney, for facilitating today's discussion. There are so many things that keep me up at night relative to the pandemic. First, just worrying about those who are impacted. The feeling of survival mode by many of our allies, those whose assets are limited, their income's constrained, but they're employed. They're working every single day. Some of them, of course, now are not employed. Survival mode is the way of life for so many of our individuals in our community. They're facing so many challenges every single day and lacking the vital resources and support and services. And so many of them are living, as many of us know, paycheck to paycheck. There's no safety net, there's no nest egg, there's no rainy day fund, even a few lost hours on the job per week, not to mention weeks and months of paychecks has disastrous results. It is our mandate here at United Way to help these people, to help these individuals, to really support the families more now than ever before. In fact, we have a 95-year history, literally, of making lives better every day in Greater Baltimore, especially during times of crisis. Astounding individual and corporate support for our COVID-19 Community Fund equates to community trust in our singular ability, really, to provide what's needed, where it's needed, effectively and also efficiently. And our overall value locally, I really believe, is strengthened by the backing, support, and resources of United Way Worldwide, an international philanthropic powerhouse. I'll turn it back to you, Whitney.
Yeah, thank you for sharing those thoughts, Franklin. I actually want to shift over to Sandy Monk. Sandy, can you tell us how you're determining the needs within the community?
So sure, Whitney. Good afternoon, everybody. So United Way of Central Maryland historically has used data, research, and information to make informed decisions. But with COVID, it's a little more complex, as we know. So we put together a matrix of financial supports that the federal, state, and local governments are providing. We also are using our 211 call data, so not just for the number of calls, but what people are calling for, what resources they need, as well as where they're calling from, so their zip codes. We've done a survey of area nonprofits to determine what their needs are on the ground, and we will continue to do that survey every couple of weeks. We also are looking at our funding applications that we've been receiving. So what our organizations are needing for funding to help continue their work. We're also participating in many, many collaboratives, from homelessness to food access and beyond. But we also did a scan of other cities, other metro areas that had COVID hit them hard before it hit us. And so we wanted to know what types of things they were seeing, what they were needing funding for, and so we performed that scan. We also use a variety of local reporting, national reporting as well, but the Baltimore Sun in particular, we look to that every day as a source of information for us. And we try to keep these reports and data updated in real time, but at the very least 2 to 3 times per week we have these reports and disseminate them to our team so we can be kept up to date. We are seeing some growing trends, particularly around mental health. We saw that a few weeks ago. We were forecasting that we were going to see an elevated need for resources in that area. So we are putting into motion a system for addressing those needs with our 211. We're also seeing child abuse, the need to address child abuse in these times. We know research shows us that in times of crisis, child abuse goes up. And so in a period of isolation, how are people reporting that? And how are people investigating that, those reports? And so we're putting some things in place around that. But probably the greatest challenge we see right now are that bills are piling up. So regardless of the financial supports provided by the government, it's not enough. And we are really starting to see an uptick in those needs as those bills pile up. What we're forecasting out a few weeks, it's not on the radar, but we anticipate there will also be some needs around addressing funeral costs and legal services. So well, I'll turn it back to you.
Yeah, I'm glad to hear that you and the team are thinking about what's coming down the road in the coming weeks and months. Franklin, I will tell you, I've been watching all of the governor's press conferences the past few weeks, and 211 has been mentioned on several occasions. Can you tell us how 211 is playing a pivotal role?
Absolutely, Whitney. Our 211 helpline, most of you know this, but it offers 24/7 free confidential support on a wide range of health and human services issues. So our call volume has really skyrocketed. In fact, our normal call volume is somewhere between 300 to 400 calls per day. There was a 400% increase, up to 2,000 calls in one day. The average call volume during this last several weeks has been somewhere around 1,000 calls. So with their lives upended, and that happens, people are calling to get help. Questions about the virus, pressing needs for basic supports and resources. So at United Way, we mobilize and we motivate the community. In fact, 115 volunteers, literally in 24 hours, were trained to assist 211's call specialists. Some of them were professionally trained, some of them were social workers, some caseworkers, some college students, interns, and others, as well as staff to support this effort and this influx of calls. So a really big thank you to all of those folks.
Yeah, and Franklin, when I actually learned about that a few weeks ago, and how your team was able to train over 100 volunteers, I mean, that really is amazing to handle the influx of these 211 calls. We're going to poll the audience again, so if you can please look at your screen. If you would take a moment to indicate what you believe is the #1 need of those in our community who are calling 211. So again, take a look at your screen, choose the option that you believe is the #1 reason, and I'll give you just a few more seconds to respond. And let's see, so it's fluctuating, but the #1 overall response here is food. And while all of these issues have been at the forefront of 211 in our community, you're absolutely right. The actual #1 need has been food assistance. And I think given everything that we've seen on the news, our community is not so dissimilar to communities across this nation. Franklin, what else have you learned from the 211 data?
So the first point is, which comes to no surprise to many of you, is the majority of the calls are coming from Baltimore City and Baltimore County. And as we saw on the screen, food assistance really is the top need. And we responded immediately. So proud of our folks. Food pantry disbursements with the help of Holly Poultry and DJ Copic. There were chicken and breakfast sandwich giveaways and so many other things we'll talk about later. So we share data freely with our partners, other nonprofits, social services organizations to really assist them in their frontline efforts. And each time, as you said, Whitney, the governor and other local officials urge citizens to call 211 for help. We see a spike in calls.
Well, yeah, I mean, when the governor makes repeated statements about contacting 211 for help, it is bound to increase that call load. I'd really like to bring in Ann Johnson, our 211 information specialist here in Maryland. Ann, can you please tell us about the calls that you and your team have been receiving as you all are on the front lines of this crisis, and how have those calls evolved over the past few weeks?
Yes, the first wave of calls were primarily questions about symptoms, testing, how to protect ourselves and our loved ones from the virus. And then these calls transitioned to questions about the disaster declaration from the governor, and especially with regard to travel, to who was an essential worker or what business is an essential business. And we were receiving complaints about businesses or individuals who seemed not to be adhering to the declaration. And then as the situation has gone on and worsened, it has created a large-scale economic impact. Callers were calling about guidance with applying for benefits, health insurance, food stamps, unemployment. And most recently, food has emerged as the most prevalent need, with no paychecks, limited transportation, even limited visits from family and friends who traditionally had shopped for people. Our callers are struggling to obtain food. And so the meal distribution sites at schools, the food pantries, the local food giveaways, these are all now lifelines for more and more callers. And baby formula, diapers, masks, cleaning supplies, these are needs that we also hear about. And so far, there are few resources to meet that need. We do report the needs that we hear about and closely follow the development of partnerships and sources of help, so that those gaps can be filled. And the intensity of our work has increased dramatically. It is challenging to meet the demand, but we are sustained by the strength of this team and by the moving expressions of appreciation from our callers. And it helps each and every one of us remain compelled in each of our hearts to be there for our callers.
Yeah, thank you for that, Anne. And I think for anyone who has ever sat with one of our 211 specialists, they really bring a level of support that the callers can feel, and they know that we have their best interests at heart. So we appreciate the work that you and your team are doing. I do want to switch gears for a few minutes, and I'd like to bring in Trif Alatsis. Trif, you have a unique position as editor and publisher at Baltimore Sun Media. Tell us what your reporters are seeing.
Well, thank you so much, Whitney. Thanks to everybody for joining us today, and really appreciate all that United Way does and all that you do to help us as volunteers. As you all talk about how busy everyone is, we at Baltimore Sun Media have been quite busy, making sure we're delivering news through our various platforms, be it through our online, baltimoresun.com, of course, and in print. We also publish the Annapolis Capital. We also, can you still hear me?
Yes, we can.
Okay, I was getting a telephone call there. Sorry about that. You know, we publish the Capital, the Carroll County Times, and the Towson Times. Our staff, much of our staff is working remotely. As many of you are, our news reporters, our photographers, our editors, our finance team, advertising. But our factory workers remain on the job at our plant. You can't print a newspaper from your living room. So we've worked really hard to make sure that we've kept the factory safe and the people there healthy. That's why we've isolated the workers in the office complex to be away. You know, I'm just so proud of our press workers and our reporters, of course, and everybody who's done so much, our newspaper carriers. So many people depend on us to deliver the news to their doorstep every day, and of course, online as well. We have a great responsibility as the largest news organization in the region, and local news is so important, and we appreciate all that you've done to support us. Now we're going to show you a couple of front pages over the past few weeks that we've put together. This first one is kind of the beginnings of when everybody started to stay home. The headline, Maryland Stays Home. This is a front page picture, which is the imagery is quite telling. This is Thames Street in Fells Point. That's 5 o'clock on a Wednesday. And as many of you know who know Fells Point well, it does not look like that. You see how desolate it is. The other thing that has been really interesting for us as we've been covering all this is so many questions we get from readers to answer so many things that just they can't find anywhere else. And so that's what we've tried to do to make sure that we're addressing questions that come up about Maryland that you just can't find anywhere else. And so one of the stories we've done that's been quite interesting and people have, it's been popular on the site is how to treat the virus. Since so many of us need to stay home, how do you do it? And it's really how you treat it as a common cold in many cases for those who have mild symptoms. So the beauty of the internet is you can read that article whenever you want. If you were unfortunately to get sick now, you could go to baltimoresun.com and read it. This next page talks about bracing for the surge. This is a quite gripping photo of a doctor at Chase Brexton. These stories really focused on how there weren't enough materials for a lot of the hospitals, whether it be masks and gloves and of course ventilators, and you've all been hearing about that. The next front page we're going to look at is looking at the 1918 pandemic, which was the Spanish flu, and we lost sadly 4,000 people in Baltimore. We wanted to go back and look to see what we had learned from those times. And this picture is something known as Flu Hill, which is at the new Cathedral Cemetery in West Baltimore. There were so many people who died then that this part of the cemetery is known as Flu Hill because so many people are buried there. again, we have a great responsibility to cover this community and hold leaders and institutions accountable. We know people are counting on us for important news and information. And again, I'm so proud of what our team is doing. But obviously, covering all these things, there are a lot of good things too. And we did start a feature called Heroes of the Week, if we could take a look at some of those. And we're looking for people in the community who are giving back. And it's become quite popular in terms of people reading it. And we're looking for nominations. So I hope so many of you will take a look. And if you know someone who's doing something to give back during this pandemic, please consider sending us their nomination. It's baltimoresun.com/heroes. And of course, you can go to the site and you'll find ways to reach us that way. But those are kind of the highlights of the things we're doing. And again, thanks for having me today.
Yeah, Triff, before we let you go, is there a memorable story that you would like to share with us that's happened in the past few weeks?
Yeah, thanks. Actually, there is. I want to talk about this poignant moment. One of the things about our coverage is obviously we're so focused on the pandemic, but in a community, in a region like this, we obviously need to continue to cover all the news. And so unfortunately, there's still fires, there's still crime, but there are also very good things as well. So I want to just talk about, we had a couple of weeks ago, there was a fire at the historic Bible Fellowship Church in East Baltimore. And we had a photographer, Barb Taylor, who went to the scene. And it didn't have anything to do with the pandemic, but this image to me, sort of encapsulates a little bit about how many of us are feeling. Barb just did an incredible job. We found out nobody was inside the church, no one was hurt. But Barb saw that the fire was, that the spire was likely to fall. So she trained her image, she trained her camera on the steeple here. And as you see, she caught it at just the time to get the entire, you see the cross there, and it's just an incredible image, and a sad image, but without professional photographers. Barb has 30 years of experience to capture something like this. I've heard from so many of our readers, and again, we're covering so much about the pandemic. This was not the pandemic per se, but of course, we had reporters out there and photographers covering the community, and to capture this moment is really something. And we talked about the pandemic from 100 years ago, but we know people will be reading about this in 100 years, and they'll be able to see our coverage and, of course, images like this. So, yeah. Thanks.
Thank you, Triff. I think that particular picture is a stark reminder that life is still going on around us, even in the midst of COVID-19. So of course, thank you to you and your team at Baltimore Sun Media for continuing to share stories with everyone in the community. I think it would actually be great to bring Anne back into the conversation. And Anne, we would love to hear one or two stories with calls that you've experienced.
Yes. One of the calls that I had was from a senior citizen with very serious chronic health issues. He had at one time had a connection to home delivered meals, but had lost that connection. And now he was unable to go out to get food, and he was trying to reestablish that connection. He had left messages for that organization, but was missing the calls. And so he contacted 211, and we left another message together, and I offered to be another contact for the organization. The coordinator did call me. She had tried to reach my caller and didn't reach this gentleman. And I learned that he was eligible to have the service restored, and she gave me the instructions. I called him back and I followed the directions he had given me to if he didn't make it to his phone fast enough because of his disability, that I should call again right away. So that's what I did. On the second try, I did reach him and gave him the instructions. And in a follow-up call a few days later, I learned that he was now receiving meals delivered to him, and he was so appreciative.
That's great, Anne. And I think, just as we learned earlier, the food insecurity is the biggest issue facing our callers to 211. Do you have another story for us?
Yes, I had a caller who speaks only Spanish, and I used our dial-in language interpreter service so that I could have a conversation with her to learn about her need. And she had been approved as an asylee and now had lost her job. And she was very frightened that she would soon lose her housing as she had no way to pay rent. I let her know about the moratorium on evictions and also on utility shutoffs, and she was glad to learn of that. I also asked if she had applied for any benefits, and she answered that people had told her that if she did apply, she would have her status as an asylee revoked. So I told her I would follow up to get a little more information and would call her back. I contacted a person in the mayor's office of Immigrant Affairs and was advised that it certainly was appropriate for her to contact the Maryland Department of the Maryland Office of Refugees and Asylees, and that anyone with a social security number was encouraged to apply for benefits like unemployment. So I did call her back and I had let her know, and she was greatly relieved. And she was also very glad to learn about the food assistance programs in her area.
Great, thank you. I think that story really demonstrates the breadth and value that's being delivered by 211. So thank you for those stories. Franklin, as ambassadors who know that there's a great amount of need, both Anne and Triff have demonstrated that. Can you take a few minutes to share how the United Way is responding?
Thank you so much, Whitney. We really are responding, not just providing immediate assistance. We're really looking now and planning for intermediate or midterm and long-term needs. So the budgets of our families really are constrained because of lost wages, shifts that have been minimized, and then they are certainly concerned about paying waived bills and mortgages and rents that are due in the coming months ahead, right? And so, as many of you know on the call, United Way works year-round, really, to create the long-term systemic change in families and neighborhoods throughout our region. And so during this pandemic, we're leading drives for baby supplies, books, tablets for children, and so much more, as was stated earlier by Sandy. So economic and health crises caused by COVID will affect families and individuals throughout Greater Baltimore in the days, weeks, and months ahead. And so it's great to focus on the immediate, right? But we need to continue to plan and strategize how we're going to address the needs as we move forward. So I'm now going to state that many of our responses are dedicated to COVID-19, specifically through community fund and collaborative partnerships, which we're so proud of. So I'm going to ask Holly Hoey to speak now about United Way's COVID-19 fund. Holly?
Good afternoon, everybody. It's so great to see faces, friendly faces, and so many people have called in today. So thank you for your time. You know, in my 21 years at United Way, I continue to be extremely proud to be part of an organization that has always been quick to pivot to address the toughest and most pressing needs in our region. And as you know, United Way immediately responded and established the COVID-19 Community Fund. We are so grateful to all the organizations, foundations, and individuals that continue to step up above and beyond to support what's needed and where it's needed. From $5 to $500,000, these incredible Contributors are directing dollars to their passion, whether it's to support access to food, mental health solutions, our 211 helpline, or to support United Way's overall strategy. Collectively, we have raised over $1.5 million over the past month to help people now and in the long term. That's amazing. Thank you so much. We are humbled and grateful by this level of support and the community's trust and the deep faith in our work. So I want to personally thank you, personally thank you for continuing along this journey with us as a philanthropic partner and friend of United Way. Thanks again.
Yeah, thank you, Holly. Our community is extremely fortunate to have, the incredible and generous donations, both large and small, and we just appreciate all the support that's been out there. I think it would be helpful, Sandy, if you can share how the United Way of Central Maryland is using the COVID-19 Community Fund.
Sure. Again, I want to express my sincere gratitude to all of our amazing supporters. We couldn't do this without you. But our fund is going to pay for immediate assistance right now. So folks are in desperate need of food and household items. So we are making sure that there is funding available for that. We're supporting our first responders and our healthcare workers, and we're assisting other area nonprofits who have really reached or gone through their own capacity to provide services in their communities.
Yeah, and I know that the fundraising started immediately, but how have the funds reached Central Maryland communities thus far?
So the very first thing we did, as Franklin stated, was we ramped up 211. So we had to get technology, we had to train volunteers, we did drive-through pickup for the technology so folks could go home and start taking calls. We've provided support to Maryland Food Bank. We know Maryland Food Bank is a large supplier of the food that's so desperately needed now. We're partnering, as I stated earlier, around child abuse and trying to get a system in place for that. Mental health services, we're part of a collaborative, really taking a look at 211 as being that portal into mental health services and how we can expand that in the future.
Sandy, can you briefly tell us more about the collaborations and the value that's being offered through this new approach?
Sure. So we've had the opportunity to participate in 2 funding collaboratives, one for Howard County and one for the balance of Central Maryland, so Baltimore City and the 4 other counties that comprise Central Maryland. So when I say funding collaborative, I just want to be clear that the collaborative means that the funders have come together, but we retain complete control over our own funds. What the collaborative has done is provided a seamless, streamlined, easy mechanism for organizations to apply for funding. So organizations do not have to go to 4 or 5, 6 different funders or foundations, make 4, 5, 6 different applications. They can go to one place, one portal, make one application, and then those funders that are involved in that collaborative can take a look at those applications. So it's easy, it's simple, it's streamlined, and it takes the pressure off of these nonprofits that we really need to help alleviate. So in Howard County, we're part of Howard County Responds, which is a funding collaborative between United Way, Horizon Foundation, Women's Giving Circle, and the Community Foundation of Howard County. We came together and decided that we wanted to raise $100,000 in 10 days and get it out to organizations. Well, not only did we meet that goal, but we doubled it. And so we have $200,000 that they're in a review session right now, making decisions during this town hall actually, so we can get those funds out the door within the next day or so. In Baltimore City, Baltimore County, and the other counties in Central Maryland, we've come together with 9 other funders, including Annie Casey Foundation, Baltimore Community Foundation, France Merrick, Goldsecker, Baltimore's Promise, ABLE, Maryland Philanthropy Network, the Lerner and Bernard Family Foundations, and have $1.2 million that we will be distributing between April 9th and May 29th. That is a rolling application, so organizations only have to apply one time. Funding will go out the door each week. If they did not receive funding that week, their application still stays in the queue for funders to be able to provide funding at some point. So the priorities for these collaboratives We've talked about food. So food has been the #1 application that we have seen in home essentials. Nonprofit sustainability. We need to help these nonprofits that are in the neighborhoods keep their doors open, pay their staff, pay their bills. Technology capacity for those supporting COVID efforts. So while we know, United Way and others during this on this town hall have been able to shift and do things remotely and virtually, many nonprofits were not prepared for that. And so we want to help them get the technology so that they can continue to provide services virtually. I've spoken about mental health, healthcare worker support, and information sharing. We need to make sure folks have the information that they need to provide the very best services to our neighbors, our community that they can provide. But we're also involved in other collaborations. So with the state of Maryland, as you know, with 211 and referring people to 211 for information and referrals. We have a collaboration with Care First. So when folks call 211, if there are specific health-related questions, we can direct them to Care First call center and they can be taken care of. Mental health, again, meal delivery through partnership with DoorDash, making sure that folks who may not be able to get to a food distribution point can still receive food for a week. DJ Kopak Dance Party Challenge. Many folks may have participated in his dance challenge where the last one resulted in 60,000 pounds of chicken being donated by Holly Poultry. That is a lot of chicken and getting it out to many, many places. We also partner with Nature's Yoke, H&S Bakery, State Street Poultry and Provisions, and provided 30,000 breakfast sandwiches for healthcare workers. We've had diaper drives. As soon as we put a registration, up online, it gets filled. And so we appreciate all the help with diaper drives and formula, partnering with Amazon and getting sanitizing kits out to nonprofits, and then partnering also with Lyft. So helping folks get to food distribution sites or healthcare appointments by providing transportation through Lyft. And that's just a small list of the collaborations that we have had the opportunity and been privileged to participate in through the COVID.
Yeah, and it's great to see all the partnerships that you guys are forming and will continue to form in the coming weeks. Franklin, you and your team have shared a lot of good information today. So tell me, what can people do right now to support this most vulnerable population?
Thank you so much, Whitney. I will take just a couple of seconds to go through several ways that our supporters can help, right? So this will all be emailed to you as a follow-up, so no need to take copious notes on this. First is give, right? Support our COVID-19 Community Fund today. You can see the site there, uwcm.org/COVID health. Secondly is to share. So alert the appropriate nonprofits to our COVID-19 grant opportunities, both in Howard County as well as the Greater Baltimore Region Collaborative. And then thirdly, explore. So with our partner Salesforce, we're offering the Philanthropy Cloud for free through September 30th for those companies that wish to really enable their employees to engage with their communities during this crisis. And then number 4, of course, is connect. So join us for one of our special events to be much more informed of our work and to also better connect with other donors, of course. And then number 5 is serve, helping people in meaningful ways from your home. It doesn't seem intuitive for many of us, but there's so many opportunities through our volunteer portal that we can actually help people to serve, volunteermaryland.org. And then lastly, have fun, dance, right? DJ Kopak continues to host family-friendly basement parties. If you haven't joined one, please do so on Facebook Live. May 2nd, we'll have a dollar for dollar match for donations up to $25,000. Exciting opportunity to have fun as well as engage. Turn it back over to the video.
Yeah, well, I know that I will be joining the dance party with DJ Kopak on May 2nd for 2 reasons. 1, as my friends would tell you, I absolutely love to dance. And 2, I am a fellow graduate of Virginia Tech. So anytime I can support a fellow Hokie, I'm all about it. All right, guys, we're going to use the remainder of this time to answer some of your questions. So thank you for those who are adding them into the chat. And while we await your questions coming in, we will have one final poll, which should be coming up onto your screen now. And we would like to know what is most important to you personally. So please take a look at your screen. Also, please add your questions into the chat box. And as we give you just a few more seconds, I'm going to look over and see what we have here. It's fluctuating, but it looks like access to food as well as the mental health support and ability to pay bills. Those are our top three. Thank you to the United Way for all that you're doing and providing avenues in which way our volunteers can be supportive. So let me just take a look here at the chat box. Looks like we have a question for Anne. So Anne, I'm gonna ask you to make sure that you're unmuted and bring you in here for a quick question. It sounds like 211 is doing an incredible job, says this person. How are your specialists handling the stress right now?
Well, we're not side by side right now in the call center, but we are continuing to care for each other and support each other. We have the ability to text and chat with each other, to help each other find the best resources for callers, and to also share those victories that we have had in certain situations with some callers, and that has been a way to uplift each other. Yeah. We've had a couple of team Zoom meetings, which have been so nourishing to our souls to see each other's faces. Mm-hmm. And that is what we're doing to be there for each other.
Great, thank you. Sandy, it looks like I have a question for you. How are the families and students we are already serving, how are they doing? And how is our staff remaining connected to them?
It's a very good question. So our families, we are connecting them with resources. We are doing everything virtually, although we have had staff go into the community and deliver educational packets to our families that don't have the technology. So they are remaining in contact by phones, through some Zooms, and making sure that they have resources that they need for their families.
Great, thank you. And I think this is probably going to be the last question, and it's for you, Franklin. So if you can take yourself off mute. One of our attendees has asked, to what level are we engaging as a COVID-19 resource for the CARES Act, specifically on what they call the Paycheck Protection Program, or better known as PPP?
So thank you so much for the question. We're probably one of those fortunate nonprofits. At a bare minimum, we received an approval to get that notice on yesterday, literally yesterday, that we would be receiving funds through that PPP program. Excited about that. Of course, we're waiting to see the actual dollars hit the balance sheet, of course, but it's exciting to know that we applied. We talked closely with our bank, our local bank, and we are really excited that at least we received approval. I was just on a call before this call with some folks, United Way Worldwide, and a couple of the other execs from some of the other United Ways were saying the similar sentiment, that they were excited about the approval, now waiting for, because of the concern about the money's running out, at least for this first round. So
yeah. Well, I know that we had more questions that showed up in the chat box, and for all of you that are on the call, please know that the United Way of Central Maryland's team is happy to connect with you on any of the topics that were discussed today. My sincerest thanks to Franklin, Triff, Sandy, Holly, and Anne for sharing the most important information today. And thank you to the entire team at the United Way of Central Maryland for stepping up in new ways to serve our community. Franklin, I will turn it over to you to close out the town hall.
So first, thank you so much, Whitney. Can we give some waves throughout the virtual town hall for Whitney? Did a great job for facilitating our interactive town hall today. And thanks again to all of our presenters. Excellent, very thorough. And finally, I thank every one of you, whether you're part of our membership group, whether you're one of the TOCO members, EOU, whether you're a representative of a company or foundation, thank you so very much for your ongoing advocacy, for your belief in us. We take your trust seriously, we really do. And every dollar, we're really trying to spend it wisely. I received a couple of notes last week when I sent a personal thank you to those who've donated, and they were saying, we trust you, United Way, to spend the dollars wisely. So we really are trying to do that. So thank you everyone for your time. We do hope this was helpful, and we will certainly try to respond to some of the unanswered questions following. Have a great day, everyone. Thank you again so much for joining today.